Are you getting held back in the gym or in life because of pain in your lower back or in your SI joint? If so, follow along and I'm going to show you how to relieve some of that pain and get you back to feeling better. My name's Cameron Ewan. I'm a doctor of physical therapy at Bespoke Treatments, and today I'm going to show you 4 different exercises that'll help mobilize your SI joint and bring back some stability to your whole lumbopelvic region. The SI joint, or the sacroiliac joint, is a joint where your sacrum and your ilium meet. Now, normally this is an extremely stable joint, but it can be prone to dysfunction through a lot of repetitive movements, through trauma that you didn't address, or through pregnancy. And so it should be a stable joint. So the exercises we're gonna go through today are gonna help bring some relief, and those are gonna be some stretches, but we wanna make sure that at the end, we stabilize that joint. Now, the function of the SI joint is to transfer power from your legs up through your spine into your core. So it's a really essential joint for the simplest things like walking, but also the highest level of sport and action. So if you're experiencing any pain in your lower back, it could be your SI joint, but it could also be some of your lower lumbar spine joints. But the good thing about all of these exercises is we're gonna work on all of the joints in the area. So whether it's your SI joint or your lumbar spine, these exercises are gonna cover you. So this first exercise, we wanna mobilize some of the tissues around the SI joint. The muscles of the glute and some of the deeper rotators of the hip attached to the ilium, that's that second part of that SI joint. When these muscles are really stiff, they go into spasm, it can be really hard to move, so other areas are gonna compensate. So what we're gonna do is mobilize some of those tissues in a nice stretch. And I'm gonna show you a few different progressions to make sure that you don't overdo it, but also to make sure that if it's too easy, you can push a little bit harder. So what I'm gonna have Vaughn do here, he's gonna come down flat on the ground. His arms are gonna be out like a T, so straight out at shoulder height. If it's his left side that's hurting, he's gonna bring his left knee up to about 90 degrees. That gives a nice stretch to the glutes right here, as well as some of the hip rotators. He's gonna take his right hand, come to the outside of the knee, and keeping everything in his lower body very relaxed, he's gonna pull across his body. You should only feel a stretch through here. If it starts hurting, back out of it and hold there and just breathe. If you feel like it's a good stretch, take that as far as you want. Again, it should all just feel like a stretch down through here. And you see we get some movement here at the SI joint, as well as down here at the lower aspect of the lumbar spine. So you'd want to hold this position about 10 breaths and then return. Again, you want to make sure there's no pain through here. It should be a nice, gentle stretch that you can continue to push as it opens. So our second stretch is going to be a figure 4 stretch. This also stretches the muscles on the back side of the hip, but different fibers. And we're also going to be mobilizing a little bit more of the hip joint, as well as the lumbar spine. So again, we're going to have some different levels here. Go at your own pace on these ones. Vaughn's gonna take if his painful side is that left side, he's gonna cross that left foot on top of his right knee, and then he's gonna use his hand to push down on his knee until he feels a stretch in that hip. That's gonna be our first level. Again, you just wanna breathe and relax into this one. If you wanna get a little bit more stretch, you're gonna hold behind your right hamstrings and pull that knee up towards your chest. And that's gonna intensify the stretch on the back of those glute fibers that wrap around. If you need a little bit more stretch further, grab the front of your knee and again, pull into the chest. Just like the other stretches, we're gonna hold this one for 10 breaths and then we're gonna come back out of it. Feel that out, make sure you're feeling good, and then repeat. And you're gonna do that 5 times, again, as often as needed to relieve some of the symptoms you have around that SI joint. So this next exercise is very important, especially if you're prone to SI joint laxity. So we talked earlier about how pregnancy can really affect the SI joint, or if you just tend to get pain here really often, it's possible that you have some laxity in your SI joint. So it's very important that we stabilize this joint. That's where this exercise comes in. It's called the SI glute bridge. So he's gonna keep his, assuming again that it's his left side that's bothering him, he's gonna keep his left knee bent with his foot flat. He's gonna bring both hands to the top of his right knee. And he's gonna create an isometric contraction on that side. So his right knee's pulling up into his hands and his hands are pushing down into his knee. That tightens up his core and it gets the right side of his SI joint stable. From there, he's gonna push through his left foot and bridge up. He should feel a strong contraction on that left glute. Hold for 1 second at the top and then come back down. We're gonna do repetitions here. Just make sure that these are slow, controlled repetitions with a good pause at the top. Because again, we're trying to focus on that stability there. So don't rush through them. Try not to be shaky through here. You wanna make sure that you're really solid throughout the full rep. Now, this is one that we're gonna go for 3 to 4 sets of 10 to 15 repetitions, but you're only gonna do that once, okay? We're trying to strengthen the muscles. We're trying to build some stability. We don't wanna do this throughout the day. We wanna give it a chance to rest as well. Think of it as when you're going to the gym and building muscle, you need a rest as well, okay? So with this one, 3 to 4 sets, 10 to 15 reps, and you wanna make sure that you're staying really controlled through here, pushing down while lifting that opposite hip. That's gonna really stabilize all of the muscles of the SI joint, the lower back, the core, and the hip. So we get a lot going on here, but the big focus is on that SI joint. This final exercise is our side plank clamshell. Now this exercise is great because the muscles of the hip, they also stabilize the SI joint and the lumbar spine from the side. So what I'm gonna have Vaughn do here is lift the hips into a side plank. This is gonna stabilize his SI joint again on the left, and we're gonna work some of those rotators on the other side to control that SI joint. So he's gonna take that right knee and lift straight up while keeping the feet together. It's important that you stabilize on the left side while you lift that right side. So we're getting stability on one side and we're getting control on the other side. So this is one that you'd want to repeat on both sides. You want that stability and that control through the SI joint, especially if you're prone to that instability. Just like the last exercise, we're gonna go for 3 to 4 sets of 10 to 15 repetitions here. Really focus on the form that the body is straight, hips are lifted, and you're just rotating through that top leg. Those are our 4 exercises for your SI or sacroiliac joint pain. Remember, we don't want to just mobilize these joints. We want to make sure that we bring some stability to the area as well. So go through this series of mobilization to relax some of those muscles and open up some of those joints, and then conclude this series with those stabilization exercises. So try these out when you're having that SI joint pain.